Chris, and this is Landis. We're going to talk to you about some airway maneuvers and stuff like that. Real simple, really quick. I'm not going to get too in-depth here, so the big points we want to point out to you is you come upon a person at the mall or something like that, unresponsive, you think, laying on the ground. You're going to come up here and tap them on the shoulders, tap them on their feet or whatever. Are you responding? Hey, mister, you okay? You're not going to get a response, right? So you don't get a response. You're going to do it quick, head tilt, chin left. You want to try to open their airway. Maybe they couldn't breathe anymore because their tongue dropped back. We want to tilt their head back, try to get it in line, pull their chin up, and try to pull the tongue off the back of the throat there, so we have an open airway for it. If that doesn't work, we can come back here and hit tilt, and we can push the jaw up, something like that, so we can move the whole jaw up and we move the tongue off the back of the throat then too. So those are some simple things you can do out in the public area, okay? You don't need any special equipment or anything like that, it's your hands. What we do from there on up is we try to get an airway established. We're not going to have somebody there standing the whole time before that airway opens. So when you go with a nasal airway, if they have a gag reflex, or if you stick anything down their throat, they start gagging. We don't want that. We don't want them vomiting. They vomit, it goes into their lungs, they get pneumonia and stuff like that, so we don't want that. We have these nasal trumpets, they're all different sizes. You insert it, we lube it up first, we don't have the lube tonight. And then you insert it. So what you got now is an open airway to the back, to the throat. Right? It just goes in the back of your throat, it just opens it up for us. It works. It's not the greatest. It's a very small hole, so you've got a lot of resistance there. So we'll move up from there. We'll go to what we call an oral airway. We can insert this. Like I said, they can't have a gag reflex for this. It won't work. We come in. Not when you're unresponsive. Not necessarily. When you're unresponsive. It just depends on what level of unresponsiveness you are. So we get that in there. We can do the same thing. We have an open airway. All we're doing with this is holding that tongue off the back of the throat.
By the way, I got all this information from Ready.com.
So we move from those. We go to more of an advanced airway. This is what we call an LMA. It's a laryngeal mask. So what it does, it goes in the back of the throat. You got your trachea right here. It sets about right here. So we can cover up around it. So it's called a blind insertion. So we don't see it going in. Just push in until it stops. It's not that hard in the being. Right? It's not that hard. Well, yeah. And then now we have an airway again. So what I'm showing you is we're going from very simple jaw thrust to more advanced. So we go from there. We go to our more. You got it. So Landis is going to show with our ET tube, our endotracheal tube. This is our definitive airway here. This is what you'll see in the ORs and stuff like that. So you go in for surgery. They can drop this airway in. What we have here is our King Vision. It's our video scope that we carry. So we like video games, so we have our own little video game. You describe that.
What we do is when we put this in is right there's your trachea, and there's two white things. You can't really see them on the left, but those are the vocal cords. So those are our two landmarks that we're looking for to insert it to. Again, unlube right now, so. And again, this is on the mannequin. A lot of our patients are going to be vomiting because, again, this is advanced airway. This is what's going to secure our airway for sure. So a lot of times we'll have vomiting. We'll just be looking for those two white cords, but what we'll actually see is like just little bubbles from the vomit because that patient for some reason at that time thinks it's snoring respiration or whatnot. It's just enough to get a bubble, put the tube through, pull it out. We've got a little balloon in there, we'll fill up.
And this is the airway you want to get. If you don't have an airway, this is a true airway form. We know it goes from here into the lungs directly. Right? We have what we call capnography. We put a filter on here. It goes to a machine and it reads how much carbon dioxide you're moving out, and that tells us how well you're circulating and stuff like that. So this is a good definitive airway for us here. So that is our progression from the simple airway to the definitive airway. All right. The only one above this would be the crike. This is where they do a surgical airway. That's a airway of last resort. That's where we have to cut right in here and stick a smaller version of this in, and then we can breathe for you that way. It's one of those you never want to have to do because they're really in serious condition if we can't get it in this other way. So we go from those to some CPR stuff, right? CPR choking, yeah. So we move from the airway stuff. We go to the choking. So you have a victim. They do the choking, universal choking sign, whatever they were eating, they were choking on. You can go behind them. The position for your hands is between your xiphoid process, which is that little dangly thing at the bottom of your rib cage, right in the middle. You feel that, and your belly button. All right. So you go to. So where your ribs come up and meet, and you'll feel your xiphoid right there. If you push on it, it's like cartilage type thing. So you want to stay about 2 finger widths below that, because you don't want to break that off. All right, so 2 finger widths below it, but above your belly button. You get behind them, and it's a quick in and up, in and up, in and up. You're going to continue that until they get the object out, or they go unresponsive. If they go unresponsive, you lower them to the floor and just start compressions. All right, it's CPR from there. If for some reason they get it out, they'll thank you. So it's that simple a thing to remember. Okay, so it's continuous Heimlich maneuvers until it's out or they go unresponsive. For a child, for an infant, so an infant being
Less than
1 month to 1 year, it will be your infants. What you're going to do is back blows and chest compressions. So you're going to take the child in your hand and you're cradle their face in your hand here. Back blows. 5 back blows. Nice firm back blows on this between your shoulders, and you're going to have them down like this, and you're going to 5 back blows straight down like that. Flip them over. Their face will be face up. You're going to look in their mouth, you don't see it. You're going to do 5 chest compressions. All right? Turn it back over, 5 back blows here. You'll continue that each time, rotating 5. Every time you bring them with their face up, you look in their mouth and see if you can see anything. Do not put your finger in there, just blindly sweep in there. You want to make sure you see it before you just sweep. All right? You keep doing that until they get it out or they go unresponsive. Once they go unresponsive, you start your compressions, which is your 2 finger compressions on an infant. So, compressions. We move to the CPR version. Like before, I said you're going to check for responsiveness. Buddy, you okay? No response. We don't expect you to go feeling for pulses and all that stuff. What you're going to do, if they don't respond to you, start compressions. And what the compression rate is, at least 100 per minute. So if you know the song Staying Alive, you can sing that in your head while you're doing it. Staying alive, staying alive. Just keep going, keep going, keep going. We used to recommend that you do 30 compressions, 2 breaths, 30 compressions. Well, for the lay person, we don't expect you to go mouth to mouth because you're not going to have the pocket mask probably. You're not going to have the BVM and stuff like that. So what we recommend is compressions only. So just get on compressions and keep on going.
if it's your family member and you're not worried about the mouth to
If you're
mouth,
not worried about that,
is that a better option?
yes.
Or?
If you get a little air in there, the great thing about the human body, though, your lungs are holding a reserve of oxygen at all times. Every time you take a breath, you're not using all the oxygen that you bring in. There's reserve, there's residual, okay? So when you're doing compressions, you're going to use that residual up, just the passive air movement that you're creating by doing the compressions in and out, in and out, in and out, is bringing air in and pushing it out. So you're getting some air exchange. Although it's not ideal, you are getting some. So just doing the compressions is really going to help you out there. So you just keep on doing that. If you are at a place with an AED, anybody used an AED before? Any training? All right. They are very smart now. They are very user-friendly. A lot of them, you open the lid up and they start talking to you right away. Others, you got to push a button. It's a nice, usually a green button that says on it. A universal O with a line in it. You know, it's universal on button. You turn it on, it starts talking to you. It'll say place the pads. It'll have pictures on the pads where to put them. Upper right, lower left. It's that easy. It'll say plug it in. You plug it into the machine. It'll say stand clear, analyzing. You stand clear, hands off. Let it do its thing. It'll check the rhythm. If it's a shockable rhythm, it'll tell you shock advised. You'll hear it ramping up, higher sound going up. It'll say shock advice, it'll say deliver shock. You say clear, you push the shock button, boom, go back to CPR. It's really that simple. You know, in the heat of battle, you're going to be freaked out. Are you doing it right? You're doing it right. Just listen to the machine, it'll walk you through the whole thing. Most of them will tell you after you deliver that shock, they'll tell you start compressions. Start CPR. You just follow it along like that. So, I like making the habit when I'm out in the public. I try to find them. You'll find them more and more. I know the mall has them. Some of the larger stores will have them. Usually they're towards the front, towards where the cashiers are, mostly, or towards the office area and stuff like that. They are around. So. Any questions about any of this stuff right now? No? Questions? Anybody want to try an innovation?
Yes.
Me too.
Megan. Huh? Or you've done it before? I've done it. I need to do yours. Yes. I'll try it. What? Have you ever done one? Like real one?
No, I've never done one. No. I'd hope
All right.
never.
Where do you work?
This is your right hand. That's okay. This is all set up for. They're all set up that way. So you're gonna put this in. Hold it like you would a pencil, or like this. And you're real gentle. All right. Okay, you're gonna slide it in.
You travel.
Yeah, both of our primary
Yeah, we
rigs
got
have
it.
it.
Yeah. You go in.
But we've also got the back down here. The handle.
She said they're not.
Really?
Yeah.
All right. You're gonna go to the stop. So you see the airway there, right? So now you're gonna slide the tube right in the side.
Yes, there's room for you to get
Okay, now see which way it's going? Where's it going? It's going down to the socket, right? So what we typically do is we'll have a stylet.
Yeah, because I think you